Good morning and welcome to the Health Trust Software webinar on wound care documentation. We will be covering this morning how to properly document wound care in our admission visits, recertification visits, resumption of care visits, as well as our routine notes. As you can see on the screen, I'm already in my schedule for point of care. We're going to go directly into a skilled nursing admission visit and take a look at how we are going to document wound care. Once we find our visit, we will go ahead and open it up and go to our wound care page. In any visit within the Health Trust software system that you are creating a plan of care, a 485 plan of care, when you click New Wound to create your wound care documentation, that order will be created and attached to the 485 plan of care. Unlike the routine note, where you have to create a separate physician's order in order to create a wound order in the system, once you do it here in any visit type that you're creating your actual plan of care, that wound care documentation will become an order and attached to the plan of care documentation. Now that we are in the skilled nursing admission visit, we're going to go ahead and click on New Wound. As you can see, the difference between the admit visit and a routine note, we're not asked or prompted to create a physician's order. Again, this will be done for you once this order actually attaches to the plan of care. We're going to have our wound number here at the top, our start date. You will notice that we do have a warning next to the start date field that says only change this if the original wound care date did not start on this day. So we do have that warning available for you. To select your site, you may use the select link to pull up your figure and use your mouse pointer to click on what area of the body the wound is located. You do not have to use the site selector to document your wound. You can also free type in the site box. If you need to do something specific, such as the coccyx in the lower back region, you can type that out here in the site field. If we were to click in the same area on the actual figure, it's going to tell us lower back, lower left back, lower right back. But you can free type in the site field. From there, we will select our type, our measurements, our drainage, odor, amount, and type, our wound bed, our tunneling, our undermining, and our surrounding tissue. From there, we can create our orders. And then complete our documentation from there. Caregiver patient agrees to perform wound care. Skilled nurse to assess caregiver in compliance to performing wound care as ordered, so on and so forth. We will fill out the rest of our fields. And enter our frequency. Keep in mind that if you do not enter a frequency and click submit once you've completed your documentation, the system will give you a warning that the frequency must be entered before you can proceed in saving the wound care documentation. From there, we can select our status, include any additional orders that we may have, and then enter in our endpoint, the time that the wound will heal. This particular portion of the Health Trust Software Point of Care program does not auto-populate the backslashes in the date. The format still does need to be the same as it is everywhere else in the system, a 2-digit month, 2-digit day, and 4-digit year, but you will have to put the backslashes in this particular portion of the software. We can then include any additional goals that we may have. I do want to point out that both of these boxes that we're looking at for additional orders as well as additional goals are unlimited text fields. You can type out as much as you need to and not be limited by text. Once we've completed our documentation, we can then click Submit. It says we have added our wound care successfully, but I want to point out that this should be wound number 3 in this list. However, we don't see it. In the event that this occurs, simply click the refresh button, and then that will now load, showing that we have 3 wounds numbered chronologically. From this point, in any visit that you're actually creating a plan of care, if you need to document wound care after creating the wound care order, you will simply click on Document Wound Care. This will open up your screen where you can go in and do your documentation, if need be. You will notice that the wound number, site, and type, you can click in these boxes, but you cannot modify those at all. You can't change the wound number, the site, or the type. We can change the status, our measurements, our drainage, odor amount, and type, our wound bed, tunneling, undermining surrounding tissue, so on and so forth. The difference is here. We can now click as whether or not we taught the caregiver how to perform wound care, our teaching and response, and our caregiver compliance to orders. We do have an unlimited comments box at the bottom of this page as well. Once you have completed documenting for your wound, simply click Submit to save your changes. Again, when you are in any type of visit where you are creating a plan of care, the wound care order will attach to the plan of care once the visit note has been turned into care validation. On a routine note, things function a little bit differently. There is a difference when documenting wound care in a skilled nursing routine visit. I can go ahead and start my visit. Wound care documentation for a routine note is located on the Body System Assessment page. We can scroll down, and our wound care will show here on this page. As you can see, with this particular patient that I have, we have 13 wounds. If you need to document a new wound on a routine visit note, you will simply click New Wound. The system will ask if you'd like to create a physician order as well. We would click OK for yes, cancel for no. We'll go ahead and click OK. And it's going to bring up my Add Physician's Order screen. Now, to add your wound care documentation, to make it a little bit easier and only have to type it one time, instead of typing out your wound care orders here in the Orders field, you can go to your Interventions button, click the field next to Add a new wound care order for the patient, click Continue. This will then bring up our Add Wound and Wound Care Orders screen. As you can see with this particular patient that we have, our wound number has jumped to 14 since we had 13 wounds already. Our start date has been entered. We can now go in, select our site. Again, we can either select from the figure or we can type in the field box next to site. We can then select our type, measurements, drainage, odor amount, and type, so on and so forth. Exactly like we did in the admission visit. Now, the difference with doing it this way through your interventions in the skilled nurse routine note is very apparent. Instead of having to type the documentation twice, as I mentioned earlier, we can do this one time. I'll go ahead and fill out my documentation. I will take and fill out my orders. How I'm going to cleanse the wound. Add in my frequency. The status of my wound. Any additional orders. An endpoint. Remember to include the backslashes. Those will not auto-populate. Any additional goals, I will then click Submit. It is telling me that the wound care order has been saved successfully. I will click OK. Now, as you can see, under our Orders field here in our Add Physician's Order screen, everything that we just typed in for that wound care is now populated in the Orders box. So we don't have to go back in and retype all of this. We're automatically creating that order. We can then scroll down, fill out our tracking information, e-sign, click Submit, and the wound will now be saved in the list. From here on out, as it would be in the admit, the recertification visit, or resumption visit where you are creating a plan of care, we will then click on Document Wound Care to go in and do our documentation. Again, we are not able to modify the wound number, the site, or the type. These areas are grayed out. You may only do your measurements and your typical documentation. Click Submit once you've completed it. You will notice within the note, next to each wound, we have two links, Document Wound Care and Modify Orders. Document Wound Care does exactly that. You go in and you document on that wound. Modify Orders should only be used if you are modifying the order for that particular wound. If we click on Modify Orders, it will allow us to go in and make any changes to this order that we need to. Once we have made those changes, we can then click Submit to save the changes to that wound care order. However, once you have clicked Submit, you will then have to go to your physician's order page and complete a new order for wound care documentation for what you just modified for that order. There is a way around this. If I go back to the Body System Assessment page and scroll down to my wound care, I do not have to use the Modify Orders if I need to modify the order for this wound number 1 on the right chest. I can click New Wound. It's going to ask me if I would like to create a new physician order as well. We are going to click OK. It is then going to pull up another Add Physician's Order screen. But instead of adding the new physician's order and having to type out our orders here in the field, we can go back to our Interventions button, go down to Edit or Discharge an existing wound care order for the patient, click Continue. It will then pull up our existing wounds. Here is our wound number 1, right chest. We can then click Edit, make our modifications to that order, click Submit. It will be saved successfully, and our wound care orders that we modified will now be here in the orders box to be sent to the physician. So by using the new wound documentation when needing to modify orders, you're cutting back on a little bit of the work that you have to do in order to get that order created for the physician to sign. This concludes our webinar on wound care documentation. If you have any questions, you may always contact our customer support department or our onboarding department, and we would be happy to answer those questions that you have. Thank you very much. Have a wonderful day.